Hello friends, welcome to Cortex YouTube channel. Today in this video, I am going to discuss about electrocardiography, that is ECG. So, what is electrocardiography? Electrocardiography is nothing but graphical representation of electrical activity in the heart. So, you should know what is the electrical activity in the heart, the basic points. Let's suppose this is your heart, these are our chambers, and this is your SA node, this is your AV node, bundle office, right bundle branch, left bundle branch, and these are your Purkinje fibers. And current from SA node to travels to AV node via internodal fibers, two on the right side, one on the left side. So few basic things about this electrical conduction system is fastest are yours Purkinje fibers, slowest are your myocytes, cardiac myocytes. Okay, SA node is the pacemaker. That means every beat is produced by SA node. SA node is the boss, so it fires the every beat. Next, so this is about electrical wiring system of the heart, and later about something about graph. ECG paper has big boxes, and each big box has 25 small boxes. One big box means 5 mm. One small box means 1 mm. So ECG, this is about paper. And next, whenever you are going to read or interpret an ECG, you must make sure that it is taken properly. So how to know that it is taken properly? First thing that is you have to see is standardization. What is this standardization? Paper should move in a certain speed, and it should be calibrated, voltage calibrated. So paper should run in 25 mm per second. That means 5 small box. I write 5 big box means 1 second. Let's suppose one big box, 2, 3, 4, and 5. This length is 1 second. Okay, and 10 millivolt means 10 mm means 1 millivolt. That is, this is on y-axis, this is on x-axis, this is on y-axis. That is, two big boxes means 1 millivolt. If one wave crosses this, it is 1 millivolt. Okay, so this is about standardization of the ECG. Next thing that you have to see is lead 1. In lead 1, all waves should be positive. When I say positive in ECG, it means upright. And lead AVR, all waves should be negative. That means downward. So this you have to ensure before reading any ECG. So after ensuring this, first thing that you have to calculate is rhythm. So what is rhythm? Rhythm is normally, see, SA node fires all the beats, so normally there will be normal sinus rhythm. So how to know that the given ECG is in normal sinus rhythm? For that you have to see P waves. Every P wave should be equal to every P wave. See, that means every P wave should be morphologically similar, and that is one point. The second point is every P wave should be followed by QRS. That is second point. Third point is RR interval is equal to RR interval. So I will. So this is about rhythm. So rhythm is look in lead number 2. Okay. After ensuring that it is in normal sinus rhythm, next thing that you have to do is, don't worry, I will be explaining with an example. That you have to calculate is rate. Rate is also seen in lead 2 only. So how to calculate rate? See, there are two methods. If normal sinus rhythm is there, one method. If sinus arrhythmia or arrhythmias are there, there is one more method. So let's suppose it is in normal sinus rhythm. You have to calculate 3. You have to divide 300 by number of big boxes. If I write capital letter R, it is big boxes. Number of big boxes between RR interval. Let's suppose number of box is 5. Your heart rate will become 300 over 5, 60 beats per minute. If number of boxes are 3, 300 by 3 means 100. So your heart rate becomes 100 beats per minute. So heart rate of anywhere between 60 to 100 is normal. that is 5 to 3 boxes. 3 to 5 boxes are normal. So anything less than 60 is bradycardia, anything more than 100 is tachycardia. So just by looking at the rate, we can diagnose many conditions. So let us now look at the causes for sinus bradycardia and sinus tachycardia. So sinus bradycardia, is it normally seen? Is it normally seen? Can I have sinus bradycardia? Yes, during sleep. Okay. Next, athletes trained yoga people, they'll all have bradycardia because of high vagal tone, and in older age group. Okay. Next, any abnormal condition that can result in sinus bradycardia, endocrine causes, your hypothyroidism will cause bradycardia. Addison's disease will cause bradycardia, and your inferior wall MI will cause bradycardia. One more ECG finding of hypothyroidism is low voltage complexes. Inferior wall MI, there will be ST elevation in 2, 3 and AVF. Okay, these are the ECG findings of inferior wall MI along with bradycardia. Next, there will be raised ICT. Raised ICT will cause, that is raised intracranial tension will cause bradycardia. One more ECG finding of raised ICT is your global T wave inversion, giant T wave inversion. It's a part of bradycardia, is a part of Pachen's reflex, bradycardia, hypertension and abnormal respiration. So these next abnormal conditions include hypothermia. Here you will also see Osborne waves. Then see, during initial part of the shock, there will be compensation in the form of tachycardia. But when the shock decompensates, even heart will also gives up and it causes bradycardia. So decompensated shock, your D shock, not your G shock. So D shock will cause bradycardia. So any drugs which causes bradycardia, we know. Just remember A, B, C, D. A means adenosine. A also means amiodarone. B means beta blockers. C means calcium channel blockers. D means digoxin. One more is ivabradine. So all these drugs will cause bradycardia. Okay. So these are the conditions where you get bradycardia. So just by looking at the rate, you can diagnose these many conditions. So now let's look at the sinus tachycardia cause. Can it be normally seen? Yes. Exercise, younger age group, that is children, infants. Any abnormal conditions? Yes, exactly. Here hypothyroidism, here hyperthyroidism and pheochromocytoma, anterior wall MI, then fever, pain anywhere in the body, hypoglycemia and compensated shock, hypoxemia. All these conditions will cause tachycardia. And any drugs that causes tachycardia? Yes, whenever COPD patient comes or asthma patient comes, what you give nebulization, that is salbutamol. Salbutamol will cause tachycardia and tremors. Next, OP poisoning patient comes, what you give? Atropine, that also causes tachycardia. Then adrenaline causes tachycardia. So these are all the drugs which cause tachycardia. So just by looking at the rate, you can diagnose so many conditions. Now let's calculate the rhythm and rate for this condition. Okay. See, so first thing, okay, assuming that it is taken properly, see, lead 1, it is positive, lead AVR, it is all waves are negative, so it is taken properly. So next you have to look at this lead to for rhythm. You see there are p waves, all p waves are looking normal. Let's look at in this rhythms too. All p waves are looking normal. So every p wave is followed by QRS, p wave QRS, p wave QRS, and there is a regular RR interval. Look at this RR interval, it's regular, so it is in normal sinus rhythm. Once you ensure that, next thing that you have to know is rate. So what is the distance between two RR waves? So almost 1 2 2.5 or 3 1 2 1 2 2.5 or 1. Let's suppose it is 2. Okay, 2.5 or 3. We'll take it as 3. 300 by 3 means 100. So if you take 2.5, it will be more than 100. Let's suppose 300 divided by 2.5. So how much it will come? 300 by 300 over 2.5 means it comes around 120. So 120 beats per minute means it is tachycardia. So sinus tachycardia is there in this case. So I think you understood this, how to calculate rhythm and rate. Next thing that you have to know is axis. After calculating rhythm and rate, you have to next thing is axis. What exactly is axis? Axis simply means the direction of current flow. Direction of current flow, in what direction the current is flowing, whether it is in the right direction or left direction or in the normal direction. So how to know the given ECG is in normal axis or right axis divisions? For that you have to look at lead 1 and lead AVF. There are so many methods. The simple method is this lead 1 and lead AVF. Why we choose these leads? Only because they are perpendicular to each. Let's suppose if you draw like this will become your lead 1 lead 1 positive, lead AVF positive, lead 1 negative, lead AVF negative. Okay, so they are perpendicular to each other, so these leads are taken. So let's suppose lead 1 what you have to look at in the lead 1, you have to look at the QRS, whether it is predominantly positive or negative. In lead 1 QRS is predominantly positive and lead AVF QRS is predominantly negative. So one is going up, one is going down, both are leaving each other. L for L means left axis deviation. So lead 1, if the QRS is predominantly positive and lead AVF QRS is predominantly positive, both are up means normal axis. In lead 1 QRS is predominantly negative and lead AVF QRS is predominantly positive. One is going down, one is going up, both are reaching each other, R for R, right axis deviation. What if both are predominantly negative? It is extreme axis deviation. So where do you get this axis deviation? See, axis deviation means, let's suppose I will tell you a simple logic here. Left axis deviation simply means more current is going on the left side or there is no current going on the right side. This is as simple as that. I will repeat. Left axis deviation means all the or majority of the current is going on the left side or there is no current which is going on the right side. So that means, and this is one basic thing, and another basic thing that I want you to remember is more muscle mass, more current. So left axis deviation means left side more muscle mass, that is called as LVH. So that's why there is LAD. And right axis deviation means right sided more muscle mass, that is RVH. That's why there is RAD. So let's look at the causes for LAD and RAD. LAD and RAD. Okay. As I told, it is here LVH, here it is RVH. So let's suppose left axis deviation means I told majority of the current is going on the left side or there is no current on the right side. So right sided MIs, like your inferior wall MI. So there is no current which is going on the right side, so all the current is going on the left side, left axis deviation. So okay, and what if there is ventricular ectopic, premature ventricular complexes on the premature ventricular complex, where they are present, whether they are present on the right side or left side, it depends, and it causes left and right axis deviation respectively. And left axis deviation, one more cause is here left bundle branch block and Wolff-Parkinson White syndrome. Here also Wolff-Parkinson White syndrome will cause right axis deviation. you can see my video on Wolff Parkinson White syndrome, the link of which will be given in this description of this video. So please watch that, then you will understand it. So in the right axis deviation, let's suppose there is here also PVC I told here, yeah, there is lateral STEMI, lateral wall MI. So no current is going on the left side, though all the current is coming on the right axis division. So any like your dextrocardia will have right axis deviation. So it may be normal in children. So these are the few conditions where you get LAD and RAD. So yeah, this is it. Okay, I will explain with this axis division with the examples. After that we can wind up this session. So what happened to this? So rate rhythm I told. Now we will discuss about axis. Okay, what you have to see, lead 19, lead AVF. So in that what you have to see is QRS. So here it is predominantly up, in AVF it is predominantly down. So both are leaving each other, means this is left axis deviation. Why there is left axis deviation? You have to ask this question and you have to try to find the cause in the ECG itself. So let's look at this LVH, whether it is there or not. So lead V1, you have to calculate. LVH is calculated by SV1 plus RV6 if it is more than or equal to 35 plus non-voltage criteria, that is LV strain is there, we can diagnose it as LVH. Let's look at this. There is, okay, if I zoom here, this is 1 box, 2 box, 3 box, 4 box. 4 means 4 into 5, 20 mm. Okay. 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 See here, this is V1, this is V6. Okay, this is 4. Let's suppose V6, RV6 we have to see, RV6. So 1 box, 2 box, 3 box, 4 box, 5 box, 5. So 4 into 5 is 25, 5 into 5 means 25. So it is 45. So mm, that means it is more than 35 mm. And there is, let's suppose there is, let us look at there is LV strain or not. LV strain is looked in lead 1, AVL and V5 and V6. Okay, so lead 1 showing LV strain, AVL also showing LV strain, and V5 V6 are also showing LV strain. So there is plus LV strain also is there. Strain means your T wave sloping downwards and ST depression, that is sloping downwards, and T wave inversion. This is only strain pattern. If it is seen in 1 AVL, V5 V6, it is called as LV strain. Okay, so and voltage criteria is passed because more than 35 mm, that is 45 mm, and non-voltage criteria is also there, LV strain. So it's a case of LVH. So LVH and LAD. First we found out that it is a left axis deviation. Why the left axis deviation? You have to find out the cause in the ECG itself, that is because of LVH. Okay, we will take one more example, and this is, you have to answer this and you have to comment below your answer. Okay, pause the video, see the ECG and comment your answer in the comment section. Thank you. Hope you like this video. If you like this, please share and subscribe, and don't forget to answer in the comment section. Bye. Thank you.